Hi, my name is Laura Lugo, and I'm here today to talk to you about my experience with focal segmental glomerulosclerosis with nephrotic syndrome, also known as FSGS, and my journey. It all started for me in 2013. Prior to 2013, I was of normal health. I had no pre-existing medical conditions, no family history of pre-existing medical conditions. And one day we had gone on a trip for spring break, and we'd been in the car maybe about it was a long period of time, and when we got to our destination, I had noticed that my legs were swollen. It wasn't anything that I was what I would consider overly concerned about. It was uncomfortable, but I wasn't overly concerned about it. When we returned back to our home, I had gone to my primary care physician and I brought it to her attention, but she did not seem too worried about it. Then later, I had a hypertensive scare where my blood pressure just skyrocketed, and I ended up in the emergency room. The emergency room also did lab work and different things, and they couldn't find anything of why my blood pressure had skyrocketed, and they ultimately sent me home. It was at that time, I mean, nobody really found anything. So my primary care physician just said, well, come back and see me again in about a month. So that's what ultimately I did. At that time, this was me. I was of average build. I was not overweight. I was just a normal person. Nothing substantial about my life at all. So after about 6 months of going back and forth to the doctor and having 6 months of different lab tests, the only thing the doctor could find was that my cholesterol was elevated and that she believed that I continued to have a UTI, which was weird to me because I did not have any symptoms of a UTI, but she was diagnosing it because I had what was, in her case, protein in my urine. And so at that point, those were the only two symptoms that she found to why I had this edema. So when I tell you that I had edema, so that you understand, it wasn't just a little bit of edema, it was the type that you could press your finger in and hold, and when you would hold it, it would stay. And it wasn't all the time, so sometimes it would be quite normal, it just looked a little puffy. And then other times it was, quite considerable. So, I mean, I didn't really think anything of it. I thought maybe it was due to the fact that I was on my feet, or it just really didn't trigger any bells to me either. So this went on, like I said, about 6 months. I had remarried, and my husband had got moved to a new job in Tennessee. So we packed up, I left that doctor, and we moved away. So for a period of about another 6 months, I didn't see any doctors or anything. So about June of 2014, I had found that I was pregnant, which was an exciting time. I had gone to the OBGYN in our town and was really excited about this with my husband at the time. And this was, I was probably maybe 8-9 weeks along, and the nurse did a urinary check or urine check with the stick and dipped it. And lo and behold, she says, "Oh my, you must have a UTI. Let me give you some medicine." And again, she gave me medicine for this UTI that she thought I had. But again, I had no symptoms or any sign of a UTI. So she sent me home with medicine for a UTI, and again scheduled me to come back for another visit. So I went home, I took the medicine as asked, and I came back for my visit. Well, now the baby had no heartbeat. So, well, that was interesting. So they didn't understand what had happened. They sent me home and said, well, let's wait and see what happens, but we might have to schedule you to do a small outpatient surgery called a D&C because of the miscarriage. Of course, you know, it's a heartbreaking time for myself and my family. But we go through that and schedule for the small outpatient surgery. Well, during the outpatient surgery, I remember stressing to the doctor. I said, hey, I'm having this swelling. I've been telling you all along that I'm having this swelling. I'm having this swelling. I'm having this swelling. Is it okay to do this surgery? Is there anything that we should be concerned about? And he said, oh, no, nothing's wrong. Nothing's wrong. You'll be fine. You'll be fine. We did the outpatient surgery, and they put the liters of fluid that they put in you when you have an outpatient surgery and sent me home. By the next day, I had swollen to what I call the Stay Fluff Marshmallow Man. And my blood pressure was skyrocketed, and I didn't know what to do. So I had called the OBGYN again, and he was like, oh, well, I don't know what this is. You need to go see your primary care physician. Well, remember, we just moved to this town, so I didn't really have a primary care physician. But we had just seen we had tried to locate a primary care physician, and I had just seen one that week before, but she was brand new. She didn't know anything. But here's this OBGYN who knew more about me than the primary care, and all he wanted to do was push me off on the primary care. So I do what he says, and I go see the primary care physician, and I explain to her what's going on, and she says, oh, well, let me put you on some blood pressure medicine, because I don't know why you're swelling, and I don't know why your blood pressure is so high. And she sends me home with a blood pressure medicine. Well, then, you know, my blood pressure's sky high again, and I'm having this hypertension episode, and I can't lay back because the fluid is so massive on my chest. And I again call the OBGYN, and I'm like, hey, something is not right. And he tells me to come in, and I see him, and he prescribes me yet another blood pressure medicine. And I don't know, and I'm just listening to the doctors, and of course, you know, because the doctors are right, they know what's going on. And honestly, because I had just suffered the miscarriage, I really wasn't talking to anybody. I hadn't really discussed it with my family or my friends, but I had discussed it with my sister, who was a nurse, and she had called my brother, who is in the medical field as well, and he's a doctor. And later that night, he called me on the phone, and he said, tell me what's going on. And I told him what was going on, and I explained to him my symptom, and he hung up the phone with me and got back on the phone, and he said, I want you to stop going to your local doctors. Your local doctors are not helping you. They don't know what's going on with you. He said, you need to go to the biggest hospital in your area, and you need to find yourself help. Something is wrong. And of course, I'm like, whatever. But he hangs up the phone with me, and I tell him, because I had said, okay, whatever. But I told him I would look at it tomorrow. We'll see what tomorrow brings. And then we would go from there. Well, the next day comes, and I was actually on my way to go see the primary care, or the OBGYN. And the OBGYN had said to me, after he looked at my lab results, he said, oh, well, it looks like maybe your kidneys took a hit in the surgery. A hit in the surgery? What the heck does that mean? My kidneys? How do your kidneys relate to anything that's been going on? So I leave his office and I'm kind of dazzled, and my brother calls me and he says, "You need to go to the nearest hospital." "Where is the nearest hospital?" And I tell him. I said the largest hospital in our area would be Nashville, Tennessee, in Vanderbilt Hospital. He said, "You go there, you tell them you have the worst headache of your life, and you stay there until you see a doctor. And once you get a doctor, you tell them you think you have nephrotic syndrome." I said, "What the heck is nephrotic syndrome?" And he says, "There is something seriously wrong with you, and you need to go to the doctor." So I call my husband and we go. We sit in the ER, and honestly, at this point in time, it didn't really look like anything was wrong with me, except for the fact that I maybe gained 30 pounds in a very short period of time. But if you didn't know me, you wouldn't have known that I had gained 30 pounds in a very short period of time. So we went to the emergency room and we did what we were supposed to do, and we sat there and we had the little emergency room doctor come in, and he's probably a student, and he sits there and he's nice and he looks through all of my tests and listens to my story. And I say to him, "Look, my brother, he's a geneticist. He works for Cancer Centers of America, and he thinks I have nephrotic syndrome." And that boy looked at me, dazed and confused, and left the room. And my husband and I joke because we think he went out of the room and Googled it. And next thing we know, the entire room was full of doctors. And lo and behold, I had nephrotic syndrome. Nephrotic syndrome is a condition where your cholesterol level skyrockets. Your protein in your urine, you have high levels of protein just spilling out of your body. Your albumin, which is a part of your blood, is so low, and it causes your body to hold on to fluids. It was caused by a condition. After going through the tests and everything, I learned that it was caused by a condition called focal segmental glomerulosclerosis, or FSGS for short, which basically means some sections of your kidney filters are scarred. This disease is something that attacks 3 people in 100,000. It doesn't attack everybody. It's mostly happens to African Americans, mostly happens to men. I am not an African American male. So therefore, I wasn't the ideal candidate. And it also happens mostly to children. So doctors never even looked at it. They never even thought to look at it. After a battery of tests, I began seeing the nephrology department in Vanderbilt, Tennessee. The first thing that they do with this disease, because it's considered an autoimmune disease, it's said that what happens is something in your body is triggered that makes it your body, your immune system, attack your kidneys. Some reason, nobody knows why, your body just says, "Hey, we need to attack those. Something is wrong." So this was in the fall, early fall, very beginning of the school year of 2014 that I received my diagnosis. And by the same time of 2015, my kidneys had failed. By 2015, I had received the diagnosis that I would need dialysis and ultimately need a kidney transplant. And that's what I did. So my husband moved me back to the state of Oklahoma, which is where my children were. I went on dialysis and then ultimately received a a kidney transplant in October of 2000 and 2016. So everybody waiting in the waiting room. Since then, I have been on immunosuppressant therapy because now my body my immune system has to be suppressed so that it does not attack my new kidney. What do I have to say about autoimmune diseases? It's unfortunate because for me, I didn't look sick. Nothing in my body said I was sick. Nothing in my outer appearance said I was sick. The only symptoms that I had, I was tired. I was extremely tired. My body was swelling. And for most people, that just looks like weight gain. But when you're tired, people see that as, oh, well, she's lazy. She's not exercising. She's not doing anything. Well, that's why she's gaining weight. But that wasn't the case. I don't have corona. I have a cough. Hopefully I don't have corona, but hell, when your immune system is suppressed, you catch everything. But my advice to everybody is don't judge people on the outward appearance.